Position the needle at the mucobuccal fold above maxillary second premolar. Keep the needle parallel to the long axis of the tooth. Insertion is just a few millimeters. First, identify mental foramen. Then apply topical at the mucobuccal fold above the target site. Position yourself at 12 o'clock. Insert the needle parallel to the long axis of the tooth. Insertion is until osseous contact. First, ask the patient to look at the ceiling. Then, identify infraorbital notch. Infraorbital notch is located just below the eyeball. Then retract the upper lip, apply the topical, just at the mucobuccal fold, right below the infraorbital notch. Insert the needle at the mucobuccal fold, right below the infraorbital notch. Advance the needle straight until osseous is contacted. Make sure your syringe and needle are parallel to the long axis of the tooth. Make sure you have established fulcrum by fingers or by the back of the syringe against the lower chin. First, palpate the insertion site with a cotton swab to make sure there is no bony structure underneath. Use a mouse mirror to retract the cheek and ask patient to move the lower jaw to the side of injection to allow more space. Insert the needle at the mucobuccal fold. Needle should be aiming towards the top of the patient's head. Advance needle slowly about 16 mm. Never insert the needle to the hub. Aspirate 3 times. First, retract the cheek by placing tip of the thumb at the coronoid knot. Identify pterygomandibular raphe. Pterygomandibular triangle is located right on the raphe, about 10 mm above the thumb. Before insert the needle, use 2x2 gauze to dry the tissue. Then place the syringe opposite corner of the mouth. Then insert the needle until osseous contact is achieved. It will be about 25 mm in depth. Then aspirate twice in 2 planes. Keep your thumb at the coronoid notch all the time. Insertion site is at the mucobuccal fold, at the distal of last molar. Bring the syringe parallel to the occlusal surface of molars and insert needle until osseous contact reached. Depth of insertion is only a few millimeters. First, identify the tragus of the ear. Place the index finger at the neck of condyle right below the tragus. Create a line with the index finger to the corner of the mouth. Retract the cheek with the thumb without losing the index finger landmark. Identify mesiolingual cusp and distal buccal cusp on maxillary second molar. Insertion site is at the height of maxillary molar. Place the syringe at the opposite corner of the mouth. Target towards the index finger. Insertion at the height of maxillary second molar. Slowly advance the needle until osseous contact is achieved. Depth of insertion is about 25 mm. Aspiration twice by rotating. Identify mid-palatine suture and two premolars. Insertion site is just middle of these two structures. Apply topical. Apply pressure anesthesia using cotton swab at the insertion site. It's about 30 seconds. You will see the tissue blanching. Roll the cotton swab back and insert the needle right underneath where pressure anesthesia was. Insert until osseous contact achieved. The depth of insertion is a few millimeters. Aspirate once and slowly deposit the solution. Palatal anesthesia requires stable fulcrum. The syringe can be stabilized with the back of the non-dominant hand while depositing the solution. Identify junction of hard and soft palate. Find the soft, depressible area on the hard palate where greater palatine foramen locates. Pressure anesthesia is applied until tissue blanches. Roll the cotton swab, then insert the needle at the pressure site. Advance needle until osseous contact, then aspirate once. Stabilize the syringe well. Identify palatine suture and incisive papilla. Select one side of incisive papilla. Apply topical at the insertion site. Apply pressure anesthesia over the insertion site. Place the syringe at 45-degree angle towards the insertion site. Roll the cotton swab and insert needle until osseous is contacted. After a while, non-dominant hand can be used to stabilize the syringe. This is the example of positive aspiration. When this happens, change the both needle and cartridge. Some needles have bevel marker. This black dot on the hub identifies bevel marker. If there is osseous, make sure this bevel is towards the osseous.